it's just a joy. It's a privilege that I have in being able to be alongside you all on this journey.
It just doesn't get any better than this. It doesn't.
I feel like I'm going to get weepy. It's been a joy.
I'm with you.
When I think about the Colorado Trust, when I think about your research trials, I also think about the impact that the Colorado implementation through Investing Kids of the Nurse-Family Partnership has had on the country. We were one of the first states to bring the program out of the research setting into local communities, and now there's 40 states that are delivering this program in multiple countries. My name is Lisa Hill. I'm the president and CEO of Investing Kids, and we have the honor of delivering the Nurse-Family Partnership in the state of Colorado. We are blessed to know one another through the work of Nurse-Family Partnership here in Colorado. Dr. Olds, obviously being the founder of the program. I run the organization that oversees the delivery of that program, and Sarah is one of our board members.
Nurse-Family Partnership is a program of prenatal, infancy, and toddler home visiting by nurses for low-income mothers experiencing a variety of adversities. We began this work in 1977, and I was invited by the Colorado Trust to come out and talk with them about the program, and I did that, and I said, well, people are concerned about having nurses do this work. They think that paraprofessionals would do a better job. And so they funded a randomized clinical trial in the Denver metro area that systematically compared the relative effects of the program when delivered by paraprofessional and by nurses. The nurses produced effects that were twice as large as the paraprofessionals, and the effects were more enduring.
Let's see. There's a lot of programs that a lot of good evidence-based programs and research going on, but what's really difficult is taking it out of the clinical controlled setting and bringing it to a community setting. And that was what happened with the involvement of Investing Kids with the Nurse-Family Partnership. At the end of the trust funding, it was working in 23 counties, and now it's working in all 64 counties in the state of Colorado.
The Colorado Trust was absolutely critical to the founding of Investing Kids. They had already invested in David's third research trial, and they wanted to see that program impact Colorado communities just like we did. And their multi-year funding allowed for us to get out on the road and educate people about the availability of this program and whether or not this might be a fit. And indeed, we found it was throughout the state.
Yeah, the outcomes both quantitatively and qualitatively are huge. In Colorado, nearly 40,000 families have participated.
My name is Ashley. I have 2 babies, Elias and Eliana. I heard about Nurse-Family Partnership through Clinica Family Health. As a teen mom, I was scared. I didn't know what I was gonna do, and I didn't know if I was gonna do a good job being a mom. That first day that I met Kelly, I was nervous, but she made me feel so loved and so welcomed by her.
I've seen Ashley grow in leaps and bounds. 17 years old when I met her, and I've just seen her have this spark to want to be a really good mom.
Oh my God! She taught me how to breastfeed my baby, helped me with my baby's routines. If either of my babies aren't hitting their milestones, she gives me resources.
Wow, she almost weighs as much as her brother.
We really try to help them feel confident in their parenting. So education around how to support their child in their development and learning, providing activities they can do to bond with their children, and then also helping parents meet any sorts of goals that they might have. Ashley really wanted to get her high school diploma, and so supporting her in that. And now she is enrolled in college.
It just feels nice to have somebody that comes in and checks up on you. Sometimes my days were rough, so I definitely needed her here. She helped me emotionally and mentally for sure.
Having someone that's like your cheerleader and your champion and working with you and connecting you to resources, I think that's what makes this program and the partnership that the two of you discussed earlier that more impactful.
What we've seen in Colorado is tremendous. 90% of our babies were born full term, 88% born at a very healthy birth rate. And we have a 94% rate of initiation of breastfeeding by the clients in the program. And you think about that as it relates to attachment. You think about that as it relates to physical health.
Blue. Wish.
Good job, buddy. You've been working a lot with him on his words.
Yeah.
Yeah, I can tell.
We recognized as an organization it was going to be very difficult for those programs to financially sustain over time. So we started educating lawmakers about the availability of this program, and in 2000 we passed the Nurse Home Visitor Act, which still today in 2025 is fully funding nurses in all 64 of Colorado counties to deliver this program to over 4,000 women annually. And we were able to secure that as a consequence of the work that we did with the Colorado Trust.
Ball. Good job.
Even though the trust isn't involved in it and has not been involved in it for years, I still hear about the program, and I still run into people that are involved in the program, and still run into people who actually were moms in the program. And everybody says how wonderful it was and how it really changed their lives. Of all the things that I was involved in 26 years at the Colorado Trust, this is the one I'm most proud of.
I get so excited that what the Colorado Trust funded here in Colorado has gone nationally and internationally, because all of the lessons learned in Colorado in some way, shape, or form benefits thousands of other families and agencies and entities across the country and the world. So it's been a joy.